Now, spring is here, and that means lawns and trees are greening up, and that can mean allergies for many of us. I talked to Dr. Cassandra Brewester. She's of Midwest Health about how to deal with allergies, especially during a pandemic. So, Dr. Brewster, let's just jump right in. We're talking about allergies. When is allergy season, actually?
Well, it depends very much on where you live, Kelly. Here in Kansas City, allergy season tends to start around February when the weather starts to warm up and we start to see those tree pollens. And then the grass pollens continue all through the warm weather months. And then as we end the summer and go into the fall, we start to see those weed pollens like ragweed, and those will finally end when we get our first hard frost, whenever that is.
So, what causes allergies and why do people get them?
Well, it's funny. It's actually because of genetics. We don't inherit what we're actually allergic to, but we do tend to inherit the ability to develop allergies. So, for instance, if you have one parent that has allergies, then you're about 50% likely to develop some yourself. And if both your parents suffer from allergies, that goes up to 80%.
And right now, we're living in the world of COVID. Nobody wants to feel or even seem as though they're sick. Tell me about those symptoms and how they mimic COVID symptoms.
Well, allergy symptoms tend to be a stuffy nose, maybe itchy, watery eyes, a clear, runny nose, and then a lot of sneezing. COVID symptoms, especially when it first starts out, can mimic that quite a bit. But there's one big difference that we keep seeing, and that is a fever. Not everybody gets a fever with COVID, but nobody gets a fever when they have allergies. So if you start to have some of those symptoms and then you start to have the lethargy and a fever on top of that, then call your doctor.
And how do you know for sure what you're allergic to? Is it a test that you need to have done?
Yeah, so the best way to figure that out is to ask your primary care provider to let you see an allergist. An allergist likely will do a skin test where they inject just tiny amounts of different allergens right under the top of the layer of your skin and then see what you react to.
And you are a board certified family practitioner. So what are your recommendations for treating allergies? Is it with the medication or shot? What works better?
Well, there's just lots of different options out there, and certainly many of them are over the counter. But if you contact your primary care provider, they can definitely help direct you between different medications and whether over the counter medicines will work for you or you need something prescription. And then certainly allergy injections are a wonderful option for people. They can be a little time consuming and sometimes expensive. They're done through an allergist's office, but man, do they work well, and they tend to help your symptoms stay away for quite some time.
Yeah, I know people who have allergies here in the station, and they definitely are on top of making sure they feel good. Thank you so much, Dr. Brewster.
You're welcome. Thanks so much, Kelly.